I'm Gerry Bloom. I'm co-convener of the Health and Nutrition Cluster at the Institute of Development Studies. Okay, I'd like to talk a bit about research in context of complexity and rapid change. In the past, much of the theory and practice of health systems research first emerged in the context of the efforts of countries to set up basic service to meet the needs of a poor and largely rural population. And the underlying idea was to replicate a relatively simple model in a number of countries, and that led to a certain approach to research. Two factors are powerfully influencing health systems research and changing it. First is the speed of multiple interconnected changes that influence health and health services, and I'll say a bit more about that in a minute. And the second is the rising expectations of people for protection from epidemics and access to safe and effective health services in almost every country. This is leading to a shift in emphasis from studies of how to transfer models of health system organization to low-income countries to studies aimed at supporting health system adaptation to rapid change. First, I'll talk a bit about the kind of changes I have in mind. So many countries are experiencing all of these changes. First, rapid urbanization and changes to transport networks and economic production, leading to the emergence of new health problems and new environments within which governments have to try to tackle them. There's population aging, and that's leading to changes in the pattern of illness with a lot more chronic disease. There's increasing economic reliance on markets and integration into the global economies with all sorts of implications for health and health systems. This is leading to changing patterns of social and economic inequality, so there are new vulnerable groups with new types of health problems and new problems in getting access to services. And overarching, there are ecological changes, exposing populations to new health risks from pollution or from the emergence of possible epidemics. Meanwhile, health sectors themselves are changing in response to social and technological changes. In many countries, there have been the emergence of pluralist health systems with all sorts of providers of health services and drugs in terms of their level of skill, their level of formal registration, and their links to government. There's been growing access to health information through the media and through mobile phones, which is changing the relationship between individuals and public and private providers of health services. And there's the development of new technologies for diagnosis and treatment, which is creating new opportunities, but also new challenges. Now, any one of these changes would pose important challenges to policymakers and providers of health services. But when put together, and the degree of interconnection is creating a whole new context in which researchers and governments are having to cope. At the same time, governments are under growing pressure to meet rising expectations for access to services. There are no blueprints for how to achieve this, and research can make an important contribution. However, this will involve different kinds of research. And I want to illustrate some of the kinds of research that come largely from experiences I've had in China and in Bangladesh. And then I'll end by saying a bit about what that means for researchers. So first, for instance, in China, there were very important studies to identify emergent problems and ensure that these problems reach the attention of policymakers and the public. For example, in China, as they made the transition to a market economy, the price of healthcare was rising and more rural people were having to pay very high costs and were facing impoverishment. It was very important to identify and document it and bring it to the attention of policymakers. Then you need to work with innovators to test new approaches for addressing these problems. In China, those innovators have tended to be in local government, but in Bangladesh, it's large NGOs such as BRAC who are testing new solutions. The point about this that's different from the old view of pilots is these are solutions that could be taken to scale. And then as you do the research, you need to monitor what works and why, how could it be adapted to large-scale implementation, and also the unintended outcomes. Then governments start implementing the change. You need to support governments in taking the lessons from local experiments to scale. That means identifying problems, fine-tuning reforms, finding new solutions. And finally, you need to monitor for new problems and new priorities and generate learning from innovative local solutions that emerge. So as you can see, quite a different role for researchers and quite a different position in the reform process. In order to play this important role, researchers will need to develop new approaches to their work. The first is Don't begin with a theory of how a health system should work, but begin with a clear understanding of a problem to be addressed. Then you have to ensure that any intervention, any attempt to solve the problem is based on a very good understanding of the local context. You've got to bring different disciplines together to look at the problem from different points of view. So we have no one solution to the problem. You need to build partnerships with innovators and with policymakers to ensure that research is part of a learning process and a process of change. You need to recognize how much we do not know, and of the need to monitor for both unintended outcomes, bad outcomes of interventions, and innovations that are emerging through local efforts to address problems. And finally, we need to build mutual learning with others who are addressing similar problems in other countries through communities of practice or other mechanisms to ensure that each country doesn't have to reinvent the wheel but can share the lessons of implementing change. Big challenges, but enormous opportunities for an effective research community.